Hello everyone, I'm Sai and today I'll be discussing whether the US should adopt a national insurance model. In this presentation, I'll give you some background of the current scenario in the US. Then I'll present 3 pro arguments and 3 con arguments, and then we'll summarize both of the sides and then we'll end it. So, one of the most striking facts about the US healthcare is spending. So the US spends about 17% of its GDP on healthcare, which is significantly higher than other high-income nations. Despite this, millions of Americans are still uninsured and underinsured. So this is a major problem that we are going to see forward with it. We have to ask a question: if you are spending more than any other country, why are outcomes not proportionally better? This inefficiency is the key where people hold debates about a national insurance. So let's compare the US to other high-income countries. The differences become even clearer. In the left chart, when you see life expectancy in the US is lower than the other countries. Countries with national insurances and universal health care, they perform better in life expectancies and access to care, billing, etc. In the right two graphs, you can see that the US ranks lower in the access to care and billing disputes. So the current US healthcare system is highly fragmented. It includes private insurances and employer-based insurances, and then 21% of the US population is enrolled in Medicaid, 14% in Medicare, and 8% of them are underinsured or uninsured. Because of this fragmentation, administrative costs are higher compared to other countries, even with lower utilization. You can see the reasons for people being uninsured. They either see that the coverage is not affordable, or they are not eligible for a coverage, or they do not need or want an insurance, or signing up was too difficult, or they've lost jobs, or they can't find a plan that meet their needs and stuff. So let's see what arguments we can have in pro. The first major argument is cost control by having a central system. In the current system, the prices for drugs, procedures, and services are often negotiated by separate individual insurances. So a national insurance model will act as a single buyer, giving the government bargaining power to negotiate lower prices, like it's been doing for Medicare and Medicaid. Bunch of research shows that the cost gained from simplified payments and efficiency and fraud reduction and medication and medical equipment is higher than the cost you would get from a utilization standpoint when you have free access to healthcare. So the red bars you see on the chart here are the costs from utilization growth if you have any sort of single payer and national health insurance models, and the green yellow bars indicate the costs you could have been saved if you adopt a model. Most of the research shows that cost from utilization is less than the savings you would get if you adopt a model. The second pro argument is reduced financial burden on individuals. So currently 36.3% of Americans have medical debt, which highlights how expensive healthcare is for even insured population. So a national insurance model will reduce and eliminate out-of-pocket costs for many people. This would reduce their financial stress, reduce medical bankruptcies, improve access to healthcare, and additionally, people don't delay treatment due to cost. Then it can lead to better long-term health outcomes and potentially lower system costs. And the pro argument 3, universal coverage ensures better health outcomes. This is a chart of rankings that shows the US at an overall ranking of 10 among 9 other high-income countries. And the countries that rank higher in this are all countries that adopted a national insurance model, like the UK, Canada, Netherlands, Australia, New Zealand, and Switzerland. So, if you follow one of those models, it is guaranteed to give you a better health outcomes and better rankings in the system if you implement it as per protocol. And let's get to the con arguments. One major concern is the potential impact on healthcare workers' income. So this is a chart I made from multiple sources. You can see that the US ranks higher in income for physicians, nurses, laboratory personnel, and administration workers. So if reimbursement rates are reduced under a centralized model, this could discourage specialization or reduce incentives for entering such professions where the US already finds it hard to acquire physicians right now. So this could directly impact the quality of the care that we have. And another common argument against national systems is increased wait times. This is a big deal. In these two charts, you can see that the waiting time for a general practitioner or a nurse, the United States ranks lower. So that means it takes less time for people to find a practitioner or a nurse than other countries with the national insurance models. So, and the right chart, you can see the United States ranks lower for appointments with a specialist, while you see other countries like the UK, Canada, Sweden, Australia, New Zealand, and France that we talked about have high waiting times for a specialist. So this is often due to limited capacity being spread across a larger population. While the emergency care is usually prioritized, but delays in these kind of elective procedures can still affect the quality of life. If the US expands a national coverage without expanding its infrastructure or getting more physicians and more nurses and streamlining the process, similar delays could occur, and it would be catastrophic than the current system. So this is an important place where the US should work on if it has to put up a model, a national insurance model. And the third major concern is disruption to the private industry. The US healthcare industry employs millions of workers, and approximately 18 million healthcare workers, and a large chunk of them are insurance workers and pharmaceutical markets. Transitioning to a national insurance model will reduce the role of these private insurers and leading to like job losses and economic disruption. And a major important thing to note is there's a lot of private equity in for-profit hospitals. So if you cut the incentive for hospitals to be less profitable, there could be major economic disruptions. And drug markets are worth $1 trillion in the United States alone. So any changes to that is catastrophic. To summarize the arguments in favor, so a national insurance model will improve quality of life, reduce their financial burden, reduce bankruptcies, expand access to care, improve cost control, also shift the system towards preventative care, which is more efficient than reactive treatment, which I feel the current insurers still lack on. Overall, this presents an opportunity to restructure the healthcare system for long-term sustainability. On the other hand, there are significant challenges. Implementation is a complex scenario. There are strong opposing stakeholders, like I've told you about physicians, nurses' income, and industry workers, private healthcare insurance firms. These would disrupt existing industries, workforce structures, and etc. These barriers are a large-scale reform to be implemented, even if the potential benefits are substantial. And that's it for the presentation. If you have any questions, please let me know, and thank you.